Hello everyone and welcome to our new episode of our podcast. So the podcast where we meet the pioneer shaping the future of ophthalmology. Today I'm honored to welcome a guest whose work has had a global impact across science, technology and public health. Nikki Hafezi is the CEO of ELZA Institute in Zurich. She is a global leader in keratoconus research, and several years she was recognized as one of the top 40 under 40 most influential people in ophthalmology. Nikki has spent years working in public health, and she led the largest epidemiological study ever conducted on keratoconus. She is also one of the strongest advocates for a new era of keratoconus screening, leveraging artificial intelligence, advanced imaging, and accessible technologies to ensure early detection for every patient everywhere. Nikki, thank you so much for being with us today, despite your busy schedule.
It's a pleasure to be here. Thank you so much for the invitation.
Thank you. It's my pleasure. Can you talk us about your project?
Well, I wear a lot of different hats, like many people, but one that I'm most proud of is being a board member of the Light for Sight Foundation based out in Switzerland. So with the Light for Sight Foundation, our mission is to stop preventable blindness in children and adolescents caused by keratoconus. And we have 4 pillars of which we stand on for the foundation. The first is access to technology. Second is outreach to at-risk population groups. The third is medical training and clinical education. And the last is research. And with the research, we are really focused on epidemiological studies and finding the true prevalence of the disease all over the world.
What motivates you to work with the children?
Well, I love children to start, but from a scientific and clinical perspective, we know that the disease is most aggressive in children. And so we find that hormones actually plays a big influence in the disease. So when somebody has or is born with keratoconus, you really start to see the effects when it comes to puberty. So the idea is to be able to prevent this disease from progressing, and we're trying to do that at the earliest stage possible. This is why we're going after in-school screenings to be able to detect this disease at the earliest stage.
And what would you change in the next 10 years in this field?
The field of keratoconus, well, what we're looking to do is what we've already done with the treatment model. We call it a circle of care. So we know that to be able to detect the disease, we need modern technology. And although modern technology exists, we use the Oculus Pentacam, for example, to be able to screen these children. The challenge that we have is really economics. And so this beautiful device by Oculus is very expensive, and it's very hard to move around to the different schools. And so what our group is proposing to do is develop a smartphone-based corneal topographer that is handheld and be able to bring into the field and very easy to use, very similar to what we're doing with the treatment of cross-linking with our CI device.
You work also at ELZA Institute in Geneva, and you had also a lot of public health projects. Which one do you prefer, and do you have time for another project?
That's a very nice question. I do work at the ELZA Institute. It's actually in Zurich, so we have 2 different locations. And there are a lot of things that I love to do, and there's a lot of things that I'm not really good at. And so I always try to bring in the best people possible. So operations is something that I like to do, but I'm not very good at. So we bring in the experts. What I love to do is public policy. And so the idea is really to empower the people that are making decisions and be able to provide them with peer-reviewed publications and actual data to be able to make their decisions. So if we bridge back to Uzbekistan, and this is a country I've spent the last 5 years, what we're trying to do is a lot of these studies and being able to work with the different universities and be able to educate the policymakers to be able to perform healthcare policy, basically developing an insurance program to be able to treat these children and to go into the schools to be able to provide in-school access for the disease.
Yeah.
So to answer your question, I love operations, but I prefer public policy.
Do you think that it's easy to change policies in our countries?
No, it's actually very hard because there's a lot of different interest involved in changing policy. And the idea really is to speak to the people in the language they want to hear. So people have different motivations. And what I like to do is provide quantifiable data that is peer-reviewed. This way, there's no fighting these numbers. Something else that I'm trying to do is demonstrate what we call HTAs, or health technology assessments. So my hypothesis is that in-school screening for all children of a nation is cheaper than if a child goes blind. And so the economic burden that this child would have, especially bringing one of their parents or a caregiver out of the workforce to be able to care for them, is a lot more expensive than it would be to implement these in-school screenings. So this quantifiable figure is easier to transmit to policymakers and economists who are making these policies. And so as opposed to an emotional appeal about children going blind. So this is the approach that we're doing. Is it easy? No.
I hope we will find a solution, because blindness, it's really hard to see it in young people.
Well, you're absolutely right. And what I keep saying when I'm asked to give talks about keratoconus is, if a child can't see, he can't learn. If he can't learn, he can't work. If he can't work, he becomes a burden. And the idea with these screenings and treatments is to be able to bring these children to the point of maximizing their cognitive ability to be productive citizens in their country. And that's my goal.
I know that you worked about a huge project. You targeted, I think, 25,000 children for many years. Can you talk us about this project?
Of course. It's what we call the KMAP study. It's the global prevalence of keratoconus amongst children and adolescents. And we did a pilot study in Riyadh, Saudi Arabia, where we screened about 1,047 children, and we found the prevalence is 1 in 21. That definitely defines not a rare disease. Keratoconus is not and should not be considered a rare disease. So with that pilot study, which we published in the British Journal of Medicine, we were able to modify the protocol to be able to implement in different cities of any ophthalmologist who's interested in this particular study. And right now we've recruited a little under 20,000 pediatric patients to the study, and we're demonstrating that keratoconus is not and should not be considered a rare disease.
What is your next research project?
Well, the next research project is the continuation of epidemiological studies in Central Asia. In epidemiological studies, it's not just finding the scientific answer about how common a disease is. What we're doing in Central Asia is determining what the unmet medical needs are in the ophthalmic community. And by knowing what the unmet medical needs are, we can then translate it to investors to the country. So producers of pharmaceutical drugs and also medical devices. If with these epidemiological studies, we're able to get a statistical analysis of what diseases are relevant, then we can convince investors to be able to invest in our country. And that's what I'm doing with Uzbekistan.
And we know that research took a lot of time. Do you have time for your family, or it's difficult to have this
balance? It depends on who you ask. If you ask my husband, I'm never home. If you ask my children, they're happy for what I'm doing, but they would like me to be home as well. But what's the most important is happiness. And so when I'm happy, the children are happy. When the children are happy, I'm happy. And so I think this is the most important thing, is to be able to find balance in terms of happiness, not in terms of time.
Yeah, it's really interesting to have this balance between family and research. And when you have happiness in your life, and when we see happiness on patients, it's give us a power to continue our career.
That's actually why we do research. We do research to really improve the quality of lives of our patients. And so with every direction, every project we do, this is the focus of which we're aiming to choose. And this is the mission of the Life for Sight Foundation.
You have a project to build a hospital in Asia?
Well, I spent the last 5 years in Uzbekistan, which is the largest populated country in Central Asia. We have a population of about 39 million people, and we're growing 1 million per year. And the idea is that we would like to bridge East and West in Central Asia to be able to provide the best possible modern medicine in ophthalmology for the citizens of this beautiful country. And so the attempt, along with my local investors, is to build the largest hospital network in Central Asia. And so we plan to do that with both China and Europe partners, Chinese and European partners.
When do you think that we will build this hospital?
Well, anybody who's ever worked in Central Asia knows that it's two steps forward, one step back. And so it's not a lack of enthusiasm or energy. It's really a lack of balancing professionalism and financing. And so it's a LMIC, or low to middle income country, and it's a developing country. And so the idea is really to work together with private and public partnerships to be able to demonstrate trust and to be able to bring in the expertise to build in a high quality, sustainable model. And that's what's taking a while. But we're using a hub and spoke model in terms of our business plan. So build the hospital with the private University, and then build the diagnostic consultation and treatment centers all throughout the different cities.
When we talk about motivation, do you think that it's enough for us to continue our career?
Well, I think whatever interests you. It's also like a relationship. You can look at your partner and he or she can check all the boxes, but if you're not passionate or excited or have energy and chemistry, the relationship will be flat.
Yeah.
But even if she doesn't check all the boxes or he checks all the boxes, but there's something special about him, pursue it. Because you have to find out, okay, maybe I can compromise here or there, but I love this and this is something that I'm going forward. So this is what I say with your relationship or with your career. It's a relationship, a long-term relationship. So, compromise with certain things as long as you're passionate and interested. If you're not, then you stop.
I will give you some words and you will give me the first word come to your mind.
Okay.
Yeah.
Okay.
So public health.
Public health, access.
Family.
My family. I don't know. Layla, Lily, Lola, and Farhad.
Keratoconus.
Prevention.
Asia.
Uzbekistan. Exactly.
Your kids.
Beautiful.
Yeah, nice. Professor Hafezi.
Hardworking.
What piece of advice can you give to young ophthalmologists or young resident ophthalmologists?
Well, I have a practical advice, and it sounds strange, but I always advise people to learn their circadian rhythm. And what that means is to be able to understand where your brain and your cognitive abilities work optimally. So in my case, I can wake up very early, around 4, and this is when I do all of my critical thinking, all of my presentations, all of my financials. And then I schedule my meetings in the morning. Anything that requires me to really think. Everything else is in the afternoon. And so this is optimizing your brain capacity. Yeah. It sounds strange, I know, but really optimize and know your circadian rhythm. But in terms of a professional advice, what I always tell everybody is pursue what you're interested in. Because, of course, everybody has this traditional path. They want to do, their medical residency, then they want to do a fellowship, and then they want to go the academic, publish. Don't do that if you're not interested in it. Find something you're interested in. And if you diversify, it makes you more interesting. So I always want people to pursue what they're passionate and what interests them. And don't be afraid. Just do it.
Yeah, it's motivation.
Yeah. Whatever motivates you, whatever is interesting, because that's when you will dedicate the time. You don't even know it. Yeah. You just want to learn, and you're able to network, and you're able to discuss, and you're passionate. Follow your passions.
Because it gives us power.
Absolutely.
Power.
And in energy and inspiration.
Of course. Do you have another thing you want to say?
Well, I know you're a young ophthalmologist, so I wish you equal luck and prosperity, as well as a lot of inquisitive minds around you, and being able to develop your interest in both access to information as well as your education.
So for our audience, thank you for watching this podcast, and see you next time.